Dealing with one hot day may be doable. However, a whole string of them can really have a negative impact on your health. WRAL's health reporter Grace Haba shares advice from local doctors during this heat wave and the warning for people most at risk.
It barely takes one step outdoors for one thing to become glaringly clear. It's hot, and doctors warn if you don't take this extreme heat seriously, there's a very good chance you could end up in their ER. Just like the plants in your front yard, doctors say rising temps mean your body also needs more water.
Every summer when the temperatures start to rise, we see more patients showing up with heat exhaustion, heat stroke, dehydration.
Dr. Branson Page with WakeMed Raleigh says with multiple days in or near triple digits, the emergency room is seeing those impacts even earlier in the summer this year.
On a single day that gets really hot, folks are going to stay indoors. They're going to keep themselves hydrated. When it becomes the norm, people sort of let their guard down, and I think they stop taking those precautions.
Page warns the elderly, children, and people with compromised immune systems are most at risk, especially those taking any sort of diuretics or kidney medication.
They're going to get dehydrated more quickly. Their bodies aren't going to be able to rebound as quick as you would if you were young and healthy.
Even for those who are otherwise healthy, Page says you're not immune to the power of the sun.
Plain water is fine. It doesn't have to be anything special, but you need to continue to drink water throughout the day, even when you don't feel like you're thirsty.
He also encourages you to limit caffeine and alcohol and spend as much time indoors as possible. If you and your family do find yourself outdoors, doctors say instead of standing in the direct sunlight, opt for a spot in the shade. And either way, make sure you're keeping that water nearby. In Raleigh, Grace Haba, WRAL News.